here in Birmingham, Alabama, at the University of Alabama at Birmingham, at one of the largest hospitals in the country, we're training the next generation of leaders in medicine. Our primary goal is to create emergency physicians who are clinically excellent, evidence-based, compassionate, and above all else, patient advocates. Here at UAB, our department is divided into a system of pods. We have over 70 beds, and each day, a little over 200 patients check in. What this means is you're going to have the chance to see a ton of patients here. One of the keys to making you a leader is that we place you in prominent clinical roles early in your training, really right from the start. And here's how we do it. So your first 2 months in the emergency department, you work alongside an upper level resident. We call those buddy shifts. By month 3, you're set free, you're on your own, and you're the doctor in charge of this entire high acuity 9-bed pod. What that looks like on shift is that if a sick septic shock patient shows up, you run the resuscitation. As an intern, you do the intubation, you do the central line. Now, there's always an attending at your side in all of the pods, but one of our key values is that we emphasize early resident autonomy. You're gonna see some of the sickest patients in the country here at UAB. Here's how that breaks down. If you look at ESI level 1s, so these are STEMIs, cardiac arrest, the status asthmaticus, we see 3 times the national average compared to other similar large academic medical centers. If you look at ESI level 2s, these are really sick patients, we see double the national average. What that means is you will leave here an expert at taking care of the sickest patients in the country. We're the only ACS level 1 trauma center in the entire state of Alabama. We see about 5,000 trauma activations a year, and out of those, 1,000 of those are for penetrating trauma. What those numbers mean is that you will leave here having seen and having taken care for a large number of really sick trauma patients. We run traumas as a team with a set of alternating roles. So on odd number days, the ED resident is the trauma lead. They run the entire trauma resuscitation. When the day switches, the ED resident is then the procedure resident, which means any and all procedures that happen back in the trauma bay belong to the ED resident. Ultimately, our goal is to see our residents succeed and grow both inside and outside the hospital. If you're looking for a program that will challenge you, that will support you and make you excellent, you'll find that here at the University of Alabama at Birmingham.